men have high levels of ACE2 enzyme linked to COVID-19 infection. A study published in the European Heart Journal on May 11 found that men's blood has higher levels than women's of angiotensin-converting enzyme 2, a key enzyme used by the novel coronavirus to infect cells. The study suggests this may be why men seem to be more vulnerable to infection with COVID-19. The enzyme, also referred to as ACE2, is found in organs such as the heart, kidneys, and the tissues lining blood vessels. The researchers also discovered that ACE inhibitors or angiotensin receptor blockers do not increase the COVID-19 risk for patients taking the drugs because they do not cause higher ACE2 concentrations. The drugs are normally prescribed to people suffering from kidney disease, diabetes, or congestive heart failure. Study co-author Adriaan Voers, a cardiology professor at the University Medical Center Groningen in the Netherlands, said their findings do not support the discontinuation of these drugs in COVID-19 patients. They came to this conclusion after studying ACE2 concentrations in blood samples from over 3,500 heart failure patients from 11 European countries. Because the study began before the coronavirus pandemic, none of the patients included in the study had COVID-19. Study co-author Isaiah Sama said, "When we found that one of the strongest biomarkers, ACE2, was much higher in men than women, I realized that this had a potential to explain why men were more likely to die from COVID-19 than women." ABS-CBN reports that ACE2 is also present in the testes, so the study authors believe this might be why men have higher ACE2 concentrations. A report by Chinese researchers published in the journal JAMA Network Open on May 7 found that the novel coronavirus can remain in men's semen even throughout recovery. This suggests that the novel coronavirus may be sexually transmitted. The researchers from Shanqi Municipal Hospital said that 16% of 38 male patients they tested in January and February had evidence of the virus in their semen. This included 4 of 15 patients who were at the acute stage of infection and 2 of 23 patients who were in recovery. The researchers explained that the testes has privileged immunity, which means it cannot be fully reached by the immune system to attack viruses. According to CNN, even the Ebola and Zika viruses have been found in patients' semen, sometimes months after recovery.